Good afternoon, everyone. My name is Kendra Nixon, and I am the director of the Resolve Network. On behalf of Resolve and Circling Buffalo, I would like to welcome all of you to today's webinar, Responding to Gender-Based Violence Across the Prairies. We've had great turnout for this event. I think there was 380 people registered, so we're quite excited and quite happy that there's such a large turnout of people joining us today. As many of you know, Resolve hosts an in-person research day every year, but unfortunately with the pandemic, we are unable to do so this year. In lieu of that, we are hosting today's webinar. Of course, we hope that the pandemic situation improves next year so we can actually host a live event in Winnipeg next year in November. I also want to mention today that our webinar is to recognize and to celebrate November as being a special month in the Prairies in terms of domestic violence prevention and awareness. In Alberta, November is Family Violence Prevention Month. In Manitoba, it is the Domestic Violence Awareness Month. And in Saskatchewan, November 30th to December 6th is Violence Prevention Week. But before I go any further and before we open up the webinar, I do want to do a land acknowledgement. I would like to recognize the land we are meeting on today. Even though we are meeting remotely and we are scattered across the prairies, it's still important that we acknowledge the land that we are meeting on. I personally am at my home in Winnipeg, and the Resolve Manitoba office is located at the University of Manitoba, which is located on Treaty 1 territory. Recognizing that I'm a visitor on this land and that Indigenous peoples have inherent rights because they are First Peoples is an important step in reconciliation. So I would like to acknowledge that. So the University of Manitoba campuses are located on original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Now I would like to pass the mic over to Sharon Mason from Circling Buffalo, who's partnering with us on this event today, to say a few words herself and also to start off today's webinar. Sharon?
Hi, good afternoon. I'm very glad to be here, and I welcome everyone to our webinar, and hope that everyone has a most informative afternoon. I just want to say a bit about the board that I'm on. We are partnering with Resolve, and our board is called the Circling Buffalo Inc., and it's made up of 8 members from across Manitoba. Our objective is to reduce family violence in Manitoba First Nations by strengthening the ability of First Nations to design, control, and manage family violence prevention programs and services that are culturally and traditionally appropriate, to empower Manitoba First Nations through community-driven programming. And we also work with the Manitoba First Nation shelters. There are 5 shelters in the First Nations. Let's see if I could get the names: Nelson House, Matthias Colomb, Shamattawa, Fisher River, and Laurie House, and the newest one being Nelson House. So we have worked with them throughout our whole time. Our board has been around for at least probably about 8 years, and we do endeavor to partner with a number of initiatives. We have partnered in the past with Resolve on some of the other projects were domestic homicide and the intimate partner violence projects. So that's a bit about us. And if you want to know more information, you can always check out our website. I encourage you to check out our website. It's www.circlingbuffalo.ca. So you can check that out at your leisure. It's also my pleasure to introduce our elder, I don't want to get things wrong here. I had asked her, I don't want, do the wrong pronunciation, but I'd like to introduce Wanda Joy Murdoch. She's from the Fisher River Cree Nation. She's been an elder in residence at the Megisi since October 2020. And Wanda's spirit name is Nikan Nishkam Ashki Iskwe. So they provide spirit support for students and staff on campus. Some of the things that they do is they provide sharing circles for the students, and I think it's the staff also, and she can elaborate on that more. So I'd like to introduce Wanda Murdoch. Thank you very much.
Thanks, good afternoon, everyone. Welcome to the Sharing Circle today. I've been honored to open up with a prayer. And my name is Nikan Iskamiskiswell, with the English version that means leading Earth Woman. I've been doing my spiritual journey now for over 35 years, and come into ceremonies, learning about the Swetlodge sun dances. So this is what I bring forth as my teachings to the University of Manitoba. And I've been honored to do that on behalf of the staff and the students that are on campus. You would find me in the elders room. That's where I would be located at Megisi. Right now, because of COVID, we are doing Zoom meetings, and I'm honored to sit with you, just contact Megisi and ask for a link to get to me, and I'll be happy to meet with you one-on-one. This afternoon, I just want to first of all thank Creator for each and every one of you that's sitting in this meeting. You know that we are faced with difficulty right now because of the COVID, and we just ask Creator to be with each and every one of you and to have a better understanding working with violence in different areas, and the result of violence in relationships. Could be physical, could be mental, emotionally. But we ask Creator to give us that guidance and understanding so that we all can heal, go through this healing, and to help one another in a good way. And with His love and support, we talk about the 7 teachings. We ask Creator to give us the 7 teachings to help us to understand our identity and who we are and what the abuse is about, and we're all created by one Creator, and that we all need to walk together, hand in hand to support each other when we're weak. And so I just ask for us to come together today to have a better understanding of what this webinar is about and what these teachings are about. And with that, I will just say thank you.
Thank you, Elder Wanda Joy. We have some acknowledgements before we begin, and I'd like to do that now. On behalf of Resolve and Circling Buffalo, I do want to acknowledge the University of Manitoba for helping us organize the webinar, and especially to Chris and Luke, our IST media production service personnel who are helping us with today's webinar. As well, I want to thank Prairie Action Foundation. Prairie Action is our core funder for Resolve, and we are quite grateful for the generous funding that they provide us so we can offer these events free of charge to people. Also, a special thanks to members of the organizing committee. So in addition to Sharon and I, there are others who helped, including Alexandria O'Toole from Circling Buffalo, Nadia La Rosa from Clinic. So thanks to all of you. And of course, thank you to Patricia Carasoni, Resolve's digital communications specialist, who's quite awesome at developing all of our social media and all of our event communications. So a special thanks to her. And of course to Cindy Porcher, our office manager, who always kind of keeps all of things together and does all of these kind of technical or logistical things. So appreciate everyone who's helped make this a success. Next slide, Patricia. And for anyone who is in need of help today, you know, this event, we are aware that could trigger some, you know, some hard emotions for folks. Everybody's at home, and obviously dealing with issues of violence can be quite triggering for many of us. So instead of putting up a number of resources across the prairies, we have offered Shelter Safe website. So if you are finding that you are in need of assistance during the webinar or after, please know you can go onto Shelter Safe. It is an online resources that provides resources for all over Canada. Next, Patricia. Just a few housekeeping items before we begin. If I can ask all of you to remain muted and have your video turned off during the entire webinar. If everyone shows up, there's going to be over 380 people, so we really need to kind of keep everyone muted. We will have a Q&A session after both of the presentations, or after each of the presentations. So I'm asking that if you have a question, if you can direct it to me, Kendra Nixon, in the chat box, as opposed to sending it to everyone. So if you could do that, please, we'd appreciate it. I also want to let people know that we are recording the webinar. So please be aware of that. I'm not sure exactly what we're doing with the recording after this, but we will send information out. We might have it available through YouTube. So anyways, and I know some people have asked about PowerPoint presentations. We will ask the presenters later on after the event to see if they mind sharing their PowerPoint. Next. So as you can see, we have a tight schedule between now and 4 o'clock. We are going to have 2 presentations with about a 15-minute break in between. So I am going to moderate, and depending on how things go, we might have to shorten the break up a little bit just to kind of get everything in. I want to make sure that both groups of presenters have lots of time to present their important work. Next. I don't think I need to say anything more about the Q&A. I think I've done that. Next, Patricia. And of course, we always want people to stay connected with us. And you can do that through a number of ways, through our social media and our website and an email. So please stay connected with us. And so, you know, that we're, if you have any questions or we can assist in any ways, and you want to keep abreast of the latest on gender-based violence research in the prairies, please connect with us. Next. Next. And again, I just want to thank everyone for joining us today. And again, thank you to my co-host Circling Buffalo for making this event a success. And so without any further ado, I'm going to introduce our first presentation. If you want to load your slide. So this first presentation is entitled Pandemic Meets Pandemic, Understanding the Impacts of COVID-19 on Gender-Based Violence Services and Survivors in Canada. Speakers today are Dr. Erin Whitmore and Dr. AnnaLise Trudell. I'm not going to go over their full bios as we see them on the screen, but I do just want to introduce them a little bit, and if they may want to introduce themselves a little bit more, that's okay. Dr. Erin Whitmore is the Executive Director of the Ending Violence Association of Canada, a national organization based in Ottawa that is focused on addressing and responding to sexual and gender-based violence. Erin has over a decade of experience working in a variety of community-based academic and government research and policy analysis roles on a variety of gender equality issues. Welcome, Erin. And Dr. AnnaLise Trudell is a gender equity consultant and the manager of education, training, and research at Anova, the Women's Shelter and Sexual Assault Center in London, Ontario. She brings extensive analysis of the causes and impacts of gender-based violence and of prevention programming through her doctoral and postdoctoral research at Western University. Welcome, AnnaLise. So I'm going to hand it over to you both. Thank you again for joining our webinar today.
Thanks, Kendra.
So while Erin just pulls up our PowerPoint, thank you for being here. We wanted to just speak a bit about sort of who we are and why we're partnered together. So Erin is with a national level umbrella organization out of Ottawa, and I am with a local women's shelter and sexual assault center. And when we first sort of met, it was on another project. But what we sort of realized is that we were both wanting to capture what's happening in terms of gender-based violence services and the impact of COVID on those. So back in April, we started talking about how can we capture this moment in time and the effects it's having. So that led us to producing a survey together. And that survey started really local at my agency, and then we broadened it to a national level survey. So we'll talk about that survey today and the results of that. But why we're working together was a really fortuitous sort of random coming together. So in terms of what we'll cover today, why we did this originally, what we actually did, and then what we found, both in the sense of the impact of COVID on gender-based violence survivors and on staff across the country. And then we'll move to sort of where to now, both from what staff and volunteers told us out of the survey, and also what we have in the works coming out of those recommendations. So why did we do this? Well, I spoke about sort of our initial idea that started out in April at the beginning of COVID, but really that came from a really informed place of knowing that there was something about to hit us. So from the Domestic Violence Death Review Committee over the last couple decades, we know that there are really clear red flags that are in place prior to a domestic homicide, and that those in fact were very linked in a lot of ways to what was happening around the pandemic. So when you think about the pandemic in terms of increasing social isolation, so social isolation is one of those red flags for domestic homicide, an increase in sort of, or a decrease in mental health, or an increase in mental health needs, particularly for the perpetrator, is also one. Job loss or income loss is another one. And so we sort of saw this confluence of factors starting to brew. And there was a bit of a deafening silence, frankly, at the beginning, where we weren't seeing a drastic increase in calls to crisis lines across the country. There was almost this sense of, we're not seeing the numbers, but all the indicators tell us that something is about to happen in terms of rates of gender-based violence and directly linked to COVID. So lots of pressures on sort of relationships and on systems that could lead to an increase in the violence, and lots of pressures on the system of gender-based violence as a service area. So many of us were deemed essential depending on the province. So shelters stayed open, for example. Counseling spaces may have moved virtual, but most of them continue to offer those services. And yet we had to figure out how to do that alongside lots of other sectors in ways that were safe. So part of us, we came from sort of that vantage point, knowing, okay, well, when are we going to see the increase in calls to crisis lines, let's say? When are we going to see the increase in sort of need around shelter usage or not? Because we know all the indicators were present. And let's also look at how folks are adapting the services in this sort of unprecedented time of COVID.
Great, thanks, AnnaLise. So I'm just going to briefly give a bit of an overview of what we did and who we heard from before we get into a bit more of an in-depth look at the findings from our survey. So we launched this survey, this national survey, mid-May, about 2.5 months into the pandemic, and left it open for about 2 months, which gave people lots of time to complete the survey. In kind of broad terms, the questions that we asked on the survey really focused in 4 areas. We asked gender-based violence staff and volunteers to talk about the impact that they were seeing the pandemic having on the services that they were offering through their organizations. We asked questions about the impact that service providers were seeing on survivors, both in terms of the type of violence that survivors were experiencing and on the potentially new challenges that they were facing in seeking services. We also asked questions related to how the pandemic was impacting mental health and well-being for people who were working on the front line in these organizations. And then some questions around what it was they were thinking about, what were their concerns as we went forward moving over the next few months. When we closed the survey on July 20th, we'd heard from 376 staff and volunteers from across the country. We heard from, we received responses from people from all of the provinces and territories with the exception of Nunavut. We had a fairly equal response rate in terms of those who were working in urban settings and those who were working in rural or remote and northern regions. And then as you can see at the bottom of the screen, we asked people to identify the type of organization that they were working in. And so the majority of those who responded to the survey were working in shelter transition houses, 42%. We heard from those who are working in sexual assault services and centers. About 25% of respondents identified that as the type of organization that they were working in. And then we heard from about 33% of our respondents were working in other types of organizations that were doing gender-based violence work. So these included victim services, hospital-based domestic violence and sexual violence programs. But we also heard from organizations like settlement services and Indigenous friendship centers and organizations that were also providing support to gender-based violence survivors during the pandemic. And this in itself was somewhat interesting to us, just as a kind of reminder that gender-based violence services are happening in a variety of different settings over the course of the pandemic, and that we want to be keeping the fact that there is this really kind of diverse landscape of anti-violence services happening across the country. You'll also see that we gathered some information about the types of roles that people occupied when they were filling out our survey. So about 30% of our respondents were working in leadership roles as directors or managers in their organizations. And then the majority, 70%, were working in other types of roles in their organizations. And so the majority of those were people who were doing direct practice work as counselors, social workers, crisis responders, outreach workers. But we also did hear from people who were doing public education and awareness training and volunteers of And just a few quick notes about our methodology for the survey. So this was an online survey. It was available for people to complete in English or French. And there were some sort of different pathways through the survey that would allow us to hear from people kind of depending on their role. So we had some questions specifically for directors, people in those leadership positions, for staff in general, and then for volunteers. And we wanted to make sure that we heard from volunteers because we know that volunteers are such a vital part of many anti-violence organizations across the country, and we're still really doing a lot of work on the front lines during the pandemic. The questions themselves were both quantitative and qualitative, and we've got a couple examples of those types of questions that were included on the survey on the slide. So for example, what impact do you see COVID-19 having on survivors' experiences of using services? And we wanted to have some of those really open-ended questions so that we could hear from staff and volunteers in their own words about what it was they were experiencing doing this work during the pandemic. And we were really just overwhelmed, and we're just so grateful for the time and effort that so many people put into completing the responses and sharing with such openness and vulnerability their experiences. And I think it's really helped to paint a more nuanced picture of what it's like to be doing this work during the pandemic. There were certainly some limitations to our survey as well. This is a community-based project, and so our recruitment process and data collection were somewhat limited. As I said, this was an online survey, so we know that type of method for collecting information isn't as accessible as it could be. And certainly we want to think about how to ensure that we can capture the experiences of those who may not have the ability to complete an online survey as something that needs to be addressed going forward. We also collected indirect data on survivors' experiences. And what I mean by that is that we did want to learn about what survivors were experiencing. But in order to do that in a safe and ethical way at this time, we gathered that information through the perspective of service providers who were working with survivors. And then finally, in terms of our analysis at this point, what we'll be presenting today is really a focus kind of as broadly on the national trends that we noticed. Hopefully, we want to dig a bit deeper into some of our findings to look at regional differences, to look at some of the differences in the different types of organizations to see what we can learn. But at this point, our analysis is still focused kind of on the big picture.
So what did we actually find? In terms of information around survivors, what we heard from staff and volunteers was that 82% identified an increase in prevalence and severity of violence. So while at the time of the survey, at least, there wasn't a general pattern in seeing an increase in reporting. So we weren't seeing a pattern across the country that there were more calls to crisis lines or more asks for service use. When folks were able to reach out, that severity was much, much higher than previously stated. And I think there's one thing that preceded this survey that was really interesting to me and lines was that Stats Canada did do a one-off survey right at the beginning of this time as well. And they had found that 1 in 10 Canadian women were in fear at home. And so they were fearful of violence in that moment in time at home. And so we know that this was something that was happening, and we were starting to see that reported through the staff and volunteers' eyes as well. They also noted 20% of them noticed a change in the tactics used to commit violence. So generally speaking, the tactics around domestic violence or intimate partner violence or sexual violence is sort of another presentation if that's unfamiliar space for you. But when we're thinking about a change in it that was really linked to COVID were things like using isolation at home as a tool for engaging in violence. So sort of using the notion that she couldn't connect with her parents or her friends, and he would threaten her if she did, and so increasing that violence. You can probably hear my toddler in the background right now. There was also an increase in the misuse of information about the pandemic. So things like, you know, I will bring COVID home to you if you don't do X, Y, Z. Or misusing it in the sense that, you know, the government has said you actually can't see anybody at all, and that we really can't have any contact. So no, you can't go and meet your friend in the park, even in that space. So really leveraging it to even increase that isolation, or using it as a threat in terms of bringing it into her own home. And then there was noted that folks were monitoring and controlling access to tech. So you can imagine how all of us have increased our access to tech through COVID times. But that means that we also can see an increase in the abuse utilized through tech. So monitoring who you text, monitoring if that's your only conduit to sort of out of the home, and that would be also to calling, say, a crisis line. If he is monitoring that more than ever before and she really can't go anywhere to use a phone in other ways, of course her sort of reaching out points would be even decreased. So we wanted to include direct quotes throughout the presentation because frankly they're really powerful. So we're going to take the time to read through some of them. I've noticed that isolation during the pandemic has been a tipping point for some people, causing the abuse people experience to go from bad to worse, causing women and children to seek immediate shelter from partners. I've noticed that isolation during the pandemic, okay, that's a repeat. Many more cases of strangulation and serious physical assault, leading to a higher risk of lethality. And I've seen an increase in violence and the gravity to a level I've never seen before. And frankly, coming from the sort of folks who see violence day in and day out, to say that they've never seen that level before was really jarring. Another stat that we wanted to pull out in terms of the impact on survivors is that 34% noted changes in the mental health and well-being of survivors, and that included things like increased reports of depression, anxiety, suicidality, and self-harm. And while 34% may not seem like a lot in some ways, because frankly, the mental health rates writ large across Canada are pretty poor right now, when you're comparing that to a baseline where those rates would have been quite poor to start off with, this is a significant change. So folks who are experiencing violence and folks who reach out for services around that violence, they're already dealing with really significant mental health challenges. And so when you add on to that 34%, that's quite a bit. So with staff working reduced hours and partially from home, clients are missing the normal supports they receive. Many really miss us. Women are being triggered more frequently. The whole situation's been stressful for them and us. And survivors are experiencing an increase in triggers and stressors. There's been an increase of reports of anxiety and depression. So that's a bit of a snapshot of what's happened through the eyes of staff and volunteers in terms of the violence on survivors. There's definitely more in the report, so we'll point you to where that is if you'd like to read up more. But I'm going to pivot and talk about the changes that staff saw in terms of survivors' utilization of services and their help seeking during COVID times. So lots of sort of patterns were noted, the most overarching being that no place felt safe. So home didn't feel safe because of violence and COVID sort of in that space. And then shelters or service spaces often didn't feel safe either because communal living, it's really challenging to do social distancing in that. And it probably never feels safe at the best of times in the sense that you're having to leave your own home and everything that you know and going into a really foreign space, and it's really a crisis environment in a lot of the time. So there was always this balancing of where do I even find safety? How do I approach health and healing? How do I balance those two when we're being told to stay home, but home is no good? So some of the sort of more specific patterns that were noted. There was fears about contracting COVID when they were accessing shelter or hospital-based services. I think a lot of us in some ways have become a bit habituated as the months have worn on and sort of have gotten really used to wearing masks and going out and seeing a little bit more of the world. But in those first key months, that notion, I can remember just any idea of me leaving home felt risky, let alone going into something like a hospital or something like a shelter in a communal living space. There were fears or unwillingness to follow COVID protocols. And that's not because folks are just belligerent, that survivors are not belligerent. That really comes from a place of a lot of those protocols were really triggering. So at our shelter, as an example, having to stay 2 meters away from anybody, having to wear a mask while you're in that space, not being able to utilize the communal kitchen, but really we've sort of brought the meals to folks' places. And when they come in, they have to quarantine for 2 weeks. And that's the local guidance from our public health. So they have to isolate again. And isolation was a tactic used for most folks. That notion of having to keep distant and having no healings and supports that are physical in nature is just not what we know to be best practice. And so a lot of that can be really triggering and sort of result in some escalation. There's been an inability to participate in telephone or virtual supports due to lack of technology or internet access, lack of privacy or space to use them, or a discomfort with receiving those services in that way. So it was interesting. There were some folks that pointed out that technology actually helped increase access so that folks could engage in therapeutic spaces in ways they wouldn't have been able to before because the traveling distance was prohibitive for them and that type of thing. But conversely, there was definitely a large trend noting that utilization of technology was a barrier, that it needed to be really in person. There was a preoccupation with just meeting basic needs. So I'm not going to even think about engaging in shelter when I don't even know, or counseling when I don't even know where my next meal is going to be, or how my children are doing. Lack of availability of space. So our shelters didn't all of a sudden have more spaces. Most of us actually all of a sudden had fewer in order to support social distancing in them. So we did definitely, I know from Anova's standpoint, have to turn women away at an increased rate than we've ever had to before. And that was something that was noted more broadly across the country. And to have to turn that away at a moment of crisis is never good, and it's definitely not good.
I can tell you which one that did.
It's never not good, but it's definitely not good when you don't have friends and family where you could probably go stay because of fears of COVID. So overall, sort of the general trend of having to balance all of those things and not really feeling that there was an easy solution anywhere. We've seen an increase in calls to our crisis line, but at the last minute, survivors are changing their minds about accessing the transition house. I think there's fear among survivors of living in this type of communal setting at the time. I also think it's a bit traumatizing for residents to be faced with strict isolation and PPE, personal protective equipment requirements, as strict regulation can often be part of the abuse they face and the reason they came to us in the first place. We've had to make several changes to residents' ability to sign out, isolation upon intake, communal space restrictions, etc. And I feel that it could be a trigger to past experiences of abuse and cause really extreme harm to our clients.
Thanks, AnnaLise. So I'm going to move into the next part of our findings to talk about what it is we heard from staff and volunteers about their experiences during the pandemic as service providers. And certainly, probably not surprising to those of you listening, this was overwhelmingly a period that was marked by increased stress, by exhaustion, and a real concern and fear about what the future would hold. Almost everyone who responded to the survey said that they found it necessary to make at least one significant change in terms of how they were doing their work. So whether this was working remotely, shifting to online services, rearranging their workspaces, getting PPE, there was this sort of constant sense of change happening. And so on top of that, understandably, 84% reported at least some concern about their health while performing their job or volunteering, and 90% reported at least some negative impact on their ability to do their job or volunteer duties. And so I'm going to look a little bit closer at what we mean by some of these findings. So as I said, we looked specifically at the experiences of those who were working in leadership roles as directors or supervisors or managers. And to start out the discussion of these findings, I'll just read this quotation that a director of a shelter offered that was really representative of what we heard from a number of people who were working in these types of roles. So this person shared, if I'm awake, I'm working. It doesn't feel like there is any downtime. On top of regular work, there is all these other changes we have to look at, implement, and ensure are being followed. An overwhelming amount of information is being thrown at us from the province, the federal government, our funders, the ministry, public health, and other sources as well. No vacation at all or any days off. Every day is a work day. Exhaustion. I work in an extremely supportive environment and have a supportive home life, yet this is the most stressed I have felt in my 25-year career in this sector. And so, as you can hear in that account, it really speaks to the overwhelming amount of work and the competing pressures of doing this work in this new environment. And when we asked those who were working in these leadership roles to kind of identify some of the tasks, the new tasks that they were taking on, or the ways that their roles were shifting, we heard that 90% of them, of those working in leadership roles, were doing the work of supporting staff and adapting to these new conditions while adapting to these conditions themselves. Those in leadership positions were also doing a lot of work around developing new policies and protocols that were necessary, again, with not a lot of guidance in what these were supposed to look like. And we also heard that a number were having to make tough decisions about resources, which in some cases led to having to lay off staff or decrease staff hours. When we look at the responses that we heard from staff and volunteers, so those not necessarily working in leadership roles, we still see a continuation of this increase in stress and these increased challenges. The vast majority of our survey respondents, 81%, identified at least some increase in their level of work-related stress during the pandemic. And not surprisingly, for many, this stress was a result of the challenges and consequences of needing to start working from home or shifting their services to online. But what was also interesting in terms of what we heard about the factors that people were identifying as contributing to kind of this increased stress is these other three that we have listed here that I think really speak to the commitment that those working in the gender-based violence sector have to continuing to make sure that these services were available even during the pandemic. So a number of people talked about how their concern about how the impact was, or how the pandemic was impacting survivors who were potentially being exposed to violence and not able to reach out for help, or how the pandemic was interrupting the healing work that survivors were doing, was something that service providers were really carrying, and was something that was sort of contributing to that stress that they were feeling. We also heard about stress related to fears about illness, and also, again, that sense of responsibility for ensuring that others didn't become ill while using services. And then finally, this concern around the future and long-term consequences. And here, people spoke about concern not only in terms of what the pandemic means for the rates and type of gender-based violence, but also the health and well-being of these organizations that are so important to supporting survivors. And so we can see with the quotation that we have on the screen here that many talked about, you know, all of these challenges as kind of intersecting in ways that created a really kind of complicated and constantly evolving situation where people were having to ask, as this person did, which fire do I put out? Each one is manageable on their own, but combined, everything all at once was incredibly overwhelming. Keeping up to date on all the changes of COVID while ensuring connection is maintained with the clients, caring for others when I was struggling to care for myself. And so, I mean, many of the adaptations that those working in the gender-based violence sector have had to make, such as working from home, working online, changing your workplace protocols, are things that many people across the country have had to do over the course of this pandemic. But really came through in the experiences that staff and volunteers shared was how these adaptations were particularly difficult and unique when we think about them in terms of providing gender-based violence support. So we heard from a number of counselors and crisis workers who do specialized counseling work with sexual violence survivors and sexual abuse survivors. And they talked about what it was like for them to be doing this work, you know, in their own home, potentially with their children or their family close by, and the way that this really created a blurring of that work life kind of separation that can be really important to staying healthy and well in doing this type of work. So I'll just read this offering from a sexual violence service provider who said, working for survivors of sexual abuse, you hear a lot of horrible stories every day. Since COVID hit, I had to invite those stories into my home. My entire living space has been slimed with stories of sexual violence, making it hard to leave work at work. I think about work more often now. I feel like I can't escape it. And we have another quotation here from the shelter worker who said, COVID-19 restrictions in shelter have meant adjusting our expectations of residents and asking any residents who are unable to follow these expectations to leave shelter. Asking women to leave shelter is our worst case scenario. She is already vulnerable. Making these decisions is mentally stressful. And here we can really hear how this struggle to kind of balance the need to make sure that those who were experiencing violence had access to services was still happening, while also trying to make sure that the measures that needed to be taken to protect people from COVID-19 were also in place, and how this created a really complex situation for shelter workers and other gender-based violence service providers that they needed to navigate. One other finding that we wanted to highlight that came through in some of the responses that we received were where people were talking about how they had to cancel some of their activities, particularly related to doing prevention and education-based work around gender-based violence. So again, of course, many people have had to cancel things during the pandemic, and we still are needing to cancel things. But when we started to kind of compile a list of the types of cancellations that were happening in the gender-based violence sector, we really started to kind of notice how it points to, you know, the potential for long-term negative impacts that the pandemic can have on this really important type of prevention awareness work that is being done in the sector. So you can see, for example, that people spoke about having to cancel sexual violence prevention trainings, consent workshops that they normally offer to high school students or universities, trainings to community service providers. Again, it's a little difficult at this point to kind of measure that impact, but certainly something that we want to keep in mind in terms of some of the long-term consequences that the pandemic is having for addressing and making change related to prevention around gender-based violence. So the survey responses certainly demonstrated that this has been and continues to be a really difficult time for those working in the gender-based violence sector. But we also heard many examples of strength and resilience that people working in these organizations have been finding to adapt to these conditions, to ensure that survivors were still receiving services, and that people that those working in these organizations were still being able to take care of themselves and stay healthy. So I'll just read a couple of these success stories that people offered. So one individual wrote, "I credit our ongoing work to be a trauma-informed organization for this success. My experience of my workplace was as an anchor of safety, empowerment, collaboration, trust, and choice, as COVID provoked fear and created chaos in seemingly every aspect of our lives." And another individual wrote, "Our organization has created a pandemic policy rooted in feminist theory, which recognized the gendered impacts a pandemic will have on women. Employees have been able to take sick time to care for children and leaves of absence with full support." And so these two quotations sort of show how organizations were applying the trauma-informed feminist approaches that they use in doing their work to their organizational operations. And that really helped to support those who worked in those organizations. And then the final quotation on the screen there really speaks to just the amazing, incredible feats of achievements that people working in the sector were managed to pull off in order to make sure that people were still getting the services they needed. So this individual wrote, "We moved 120 survivors from face-to-face counseling to distance counseling in a period of 2 weeks. This is a huge accomplishment, and we have leveraged this success to further enhance our digital tools." So I'm going to move now into kind of the final section of our presentation to look at what we heard from staff and volunteers about where we're going in the future, and what are the main areas for action that are needed to make sure that survivors have the services that they need, and that the organizations that provide these services have what they need to do their work. And I'll start out by reading this reflection from one service provider that, again, is really representative of a sentiment that we heard from a number of respondents, that this idea of simply returning to normal is just not adequate. It's not enough. So this person shared, "I certainly think there will be issues in returning to normal, and this shift will occur slowly. However, I think framing it as a return to normal is incredibly problematic, because our normal before the pandemic was not serving women who experience violence well. I think we ought to look at this pandemic as a learning lesson in the bigger picture of gender-based violence. And so when we look at the responses that people provided in answer to some of the questions we were asking about, you know, what did you think was necessary in the coming months, and what would you like to see from government and other decision makers, the answers really kind of centered around 4 main areas. And I'm going to speak to each of those quickly right now. So probably not surprising to a number of you listening, the one of the big concerns that people had, and one of the things that they identified as necessary, was stable core funding that reflects the complexity of the services and the demand for services. And we certainly want to acknowledge, and we heard from many survey respondents about the emergency funding that had been provided by the federal government to the gender-based violence sector, and how important that funding was for some of these organizations to continue to do the work they needed to do during the pandemic and get the supplies they needed. However, many other people did just acknowledge that the lack of financial resources was an ongoing concern, particularly where many felt that there was going to be an increase in demand for these services, and realizing that before the pandemic started, many of these organizations were already facing challenges in terms of resources and potentially not being able to meet the demand for services. So as one respondent noted, emergency COVID funding is short-term. We need long-term and sustainable solutions. And so building on this theme of the need for long-term solutions and this importance of not just simply going back to normal, many respondents also spoke about that the need that addressing gender-based violence and gender-based violence service provision in the COVID context and beyond really needs to work harder to reflect an intersectional and systemic approach that really gets at the root causes of gender-based violence and centers the experiences of Black, Indigenous, and racialized women, women with disabilities, migrant women, and trans, non-binary, and gender diverse folks. And you can see the quotation that we have on the screen in the gray box, where this service provider, for example, spoke about how the challenges that she was seeing, the clients she was working with were not only related to violence, but also just simply meeting their basic needs, and how addressing gender-based violence can't be separated out from addressing poverty and other socioeconomic issues. As I said earlier on in the presentation, when we looked at the types of organizations that people were working at when they completed this survey, we did hear from a number of individuals working at organizations that were outside of sort of the traditional sexual assault center or domestic violence shelter type space. So we heard from people working in settlement organizations, from Indigenous friendship centers and organizations. And the responses that we heard from some of those working in these organizations, again, really pointed to this need to deepen and complicate our understanding of the sort of differential impacts of the pandemic. So one service provider who was working in settlement services spoke about the complexities for a client who was navigating gender-based violence services, but also at the same time trying to navigate the immigration system during the pandemic. And this person wrote, huge implications for clients who are in the process of obtaining status with courts, immigration, and tribunal boards still closed. This limits these survivors from financial means of moving forward with their life, such as receiving child tax, completing their taxes, applying for social assistance, accommodation, and job searching. As I said, we also heard from those working in organizations serving Indigenous women and girls about the ways the pandemic was compromising these organizations or making it more challenging for these organizations to provide services in ways that really aligned with some traditional cultural practices. And so this one respondent spoke a little bit more about that. They said the pandemic has interrupted our in-person meetings and gatherings. For an Indigenous organization, a lot of what we do is in person, in groups, and with our communities. Traditional practices and ceremonies have been paused, which are key factors in our journey to healing. A third area of action that came through, and again, really was connected to this idea of not returning to normal, was the need to make sure that we are dedicating funding and efforts to preventing gender-based violence from happening in the first place. And as I spoke about earlier, we heard from a number of staff and volunteers who were concerned about the cancellations that have happened as a result of the pandemic related to prevention and education. And we hear from one such person in the following. My role deals almost exclusively with youth within the school system via presentations and prevention efforts. COVID-19 has made my role challenging because I am unsure what the future holds and I'm unsure of future service delivery. Without a clear picture, it is challenging to know what prevention efforts look like. And so making sure that, you know, this area of gender-based violence work isn't forgotten and overlooked as we move through these next few months also seems to be something that gender-based violence service providers felt was really important to center if we're going to do more than just maintain the status quo. And then finally, the fourth action that people identified was related to the need for there to be opportunities for knowledge sharing and really championing the expertise and lessons that are being learned within the gender-based violence sector right now. And we heard some of that through our survey, and I know there are many other people who are collecting information about some of the innovative ways that the sector is finding to respond to this challenge. And then as part of this, the survey respondents also really spoke about how this expertise, this emerging knowledge really needs to be centered in any post-pandemic recovery planning.
So what do we have in the works to move this forward? A couple things. So we're developing a tool right now, working with an economist and a chartered accountant to sort of address that fiscal challenge, the first point that folks have pointed to. And the fiscal tool is going to be, it's something that Anova has used in the last year, and it allows you to plug in certain numbers that would say, you know, if we don't get an increase in funding by X% in the next 2 years, here's how many survivors we would not be able to serve. And so it directly links the lack of an increase in funding to the human sort of cost on a survivor of that. And what we're hoping is to not only be able to provide that tool on our websites so that folks could plug in their own agency's numbers to that and be able to project that out, but also to potentially be able to roll that up on a national scale. So that if the sector isn't funded adequately, then we know that hundreds of thousands of Canadian survivors will not be served in the coming 2 years, and we have a finite sense of that. And part of that is based on the notion that, you know, prior to COVID, 1 in 2 Canadian women would experience abuse or violence in the course of her life, and that rate really has remained stagnant for decades. And so this isn't something that we've done a great job at preventing, but it is a huge need. And one of the things that we also heard throughout the survey was that for some organizations, 20 to 30% of their budget line is covered by fundraised dollars. And so when you lose that ability in the context of sort of a recession, an economic downturn, but also the ability to even just host fundraising events, you're really precariously placed. And so yes, one-off dollars are great, but that's not going to recover that long term. And so let's show the impact of that through a tool. So that's in the works. Hopefully we'll have that up on our website soon. The other one is that we've just launched today that we'll be holding a spotlight on gender-based violence and COVID research on December 8th from 12 until 2 Eastern Standard Time. And so part of that was to address that last point that Erin mentioned, which was folks were really clear in saying that the sector has developed expertise around sort of policy and best practice of how to offer these services in the context of a pandemic. Like, how do you do a shelter when you have to do social distancing, and shelters have been designed in a really different manner than that. So there's some really innovative practices, and let's amplify those in the sense of community-based research in particular, but also community and academic partnerships. So we are aware of a few of those connections, but what we realized pretty quickly is that across the country, researchers are not all connected. So our hope out of this spotlight would be to connect folks, and so that we can sort of start sharing some of that knowledge base. We also are hoping to conduct a follow-up survey in March or April, so it'll have been kind of about a year since the onset, and use some of the same questions, in particular the quantitative ones, to really have a touch point again around what folks are seeing in terms of violence, what folks are seeing in terms of survivors' mental health, survivors' utilization of service, and then staff and volunteers' mental health and challenges. So we'll hopefully have a bit of comparative data that we can put out there. So we want to thank you. Thanks for holding on for what was a lot of information, a lot of sort of quotes thrown at you. If you want to delve into it more, because we did just sort of show some snapshots of it, frankly, there's the full report available on both of our websites, as well as executive summaries, so both in English and French for the executive summaries. I wanted to also point out, you probably saw peppered throughout the presentation visuals. They come from this infographic, and that was developed by a local artist in London called Emma Richard. And so just kudos to her as well. So Kendra, I don't know if you have had any questions come in or not, but we'll turn it over to you.
Great. Thanks, Erin and AnnaLise. That was a fascinating presentation. I'm so glad that you're continuing on with your research, you know, including doing the fiscal tool you talked about to assess the human cost of a pandemic such as COVID-19, as well as your follow-up survey. We received some federal money to look at the impact of COVID-19 on survivors of intimate partner violence and service providers here in Manitoba. So we'll certainly use your research to help us kind of craft additional questions, and certainly would love to attend your event on December the 8th. We did receive some questions. The first is, did your research reveal anything regarding an impact on transitional housing services during the pandemic? And before I get you to answer that, I'll just remind people that we have questions and answers till about 2:25, at which time we'll take a break.
So the question was, did we hear anything specific to transitional housing? We really haven't been able to pull out data specific to transition houses, but certainly we heard, you know, we did. I mean, we heard from a lot of shelters and transition houses. I think that was our sort of biggest group of respondents. And AnnaLise, if you, I'm just trying to think if we had any specific data from transition houses. I do think that we did hear from some service providers who just spoke about how the challenges of finding affordable housing during the pandemic and always, of course, was creating additional barriers for those who are in transitional houses and potentially looking to move out.
So to pull on specific trends for that part of the sector, no. So what we haven't done yet, and perhaps this might answer other questions, is disaggregate the data. So we don't have trends within the sexual violence versus transition housing versus domestic violence counseling, let's say. And we don't also have that across the provinces. So we don't know trends within the prairies alone versus out east. And that data is there, and it needs to be mined, but we haven't done that work yet.
Okay, thank you. Another question. Did your survey also include options for men, trans, non-binary, and two-spirit people to share the experiences of gender-based violence?
So I'll jump in. The survey was targeted to folks who work in the sector, not to the general population or to folks who are survivors. And so in order to gain access to the link, I mean, we put it out through social media, we put it out through all the networks within the sector, but it was relatively closed in that way. So if you are employed or volunteer at a space that provides GBV services and you are trans or you are male identified, you would have absolutely had the possibility of filling that in. And we did not ask for demographic details of staff or volunteers. So we don't know the percentage of those who were female identified or not, etc. But just to be really clear, there was no sort of public participation in it.
Okay, next question. Does data exist to demonstrate that poverty is a core cause of interpersonal violence, including intimate partner violence and domestic violence? Long-term universal income to be recommended. So that's a bit kind of beyond the COVID-19 question. Did you want to respond to that?
I almost feel like turning that back over to you, Kendra. That is a much larger research area that there is research on for sure, but that was not covered in the survey.
Yeah, no. I wouldn't say poverty is a cause of intimate partner violence, but certainly, contributes to people's experiences. Obviously poverty is a barrier to people leaving. And certainly I think we saw that with COVID-19 when survivors either had to quit their job or their income was reduced because they had less hours, right? And so, it wouldn't be surprising to hear that some survivors were not able to leave just because of their financial situation. Okay, next question. Can you please speak more to the increase in severity of violence? I believe the percentage shared was 20%. Are you able to provide examples of this? Does it reflect an increase in things such as weapons, severity of assault, strangulation? Thank you.
So I think the percentage was it was 82, but that looped in any change in prevalence and severity. And I think the 20% was the change in tactics, but I'm second guessing myself slightly here. Anyhow, the change around severity was really looking at, so we scaled it, so that was based on a scale. And so folks self-assessed what that meant. But what we could see when we coded some of the qualitative data was that what we know to be true in terms of more general patterns of violence, escalated violence that includes things like strangulation, that includes moving from emotional and financial abuse into a space of physicality, that includes sort of moving beyond controlling her movements to really threatening spaces. And when survivors also exhibit fear themselves, because that might sound counterintuitive, but usually survivors will validate the violence in some ways at first, sort of say, well, if I hadn't done X, it probably wouldn't have happened, or he didn't really mean that. But when a survivor really exhibits fear themselves, we take that quite seriously because they are the most in touch with what that experience is. So really trusting frontline workers to know what that means and how to address when severity has increased. And the research supports that there are particular actions even that we know lead to red flags around domestic homicide. So hopefully that kind of peppers in a few concrete examples for you around what severity meant.
Mm-hmm. Have you been hearing, I mean, outside of your own research, have you been hearing about the increase in lethality across the country? So increased lethality in terms of outcomes. I know in Winnipeg, shortly after we had our lockdown in the spring, there were, a couple of, identified domestic violence homicides in Winnipeg. Now, obviously, we don't know how much of that was directed or attributed to COVID-19, but I'm just wondering the work that you've done and just reaching out to other more national organizations or speaking to others across the country. Have others kind of noticed that this was a trend in terms of, in terms of greater outcomes in lethality?
I think that, yes, I think that people have been noticing that as a trend. And I don't have the statistic right in front of me, but I know that the Canadian Observatory Observatory for Femicide has some of those statistics and has noted an increase in domestic homicide and femicide since the start of the pandemic. Again, you know, whether that is completely contributed to the pandemic itself, we can't necessarily know that, but as we've talked about and as we heard from people, the conditions that the pandemic has created has certainly, you know, created a context where that is more likely.
Okay. I appreciate today's presentation and the survey work completed during a pandemic. Well done. What groups are missing from this survey, and is there room to collaborate with your team?
Yes, to collaborate. Erin, do you want to add to missing?
Me today, yeah, and so I think that there are opportunities for us to hear from sorry, I hope I'm just getting a message that says my internet connection is unstable. I'm okay. Okay. So certainly I think that completing a survey online isn't always accessible for everyone. And so looking for ways to hear from people who may prefer to share their responses verbally or to complete the survey in a different format is something that we could certainly look at. As I said too, one of the things that we found interesting was that we were hearing from people working in a bunch of different types of organizations. So they weren't necessarily shelters and sexual assault centers. And I think that's something that we really want to think about more and continue to look at all of the different places that people might be accessing gender-based violence services that we might not always think of when we think of what the gender-based violence sector encompasses. So like I said, that might be settlement services. It may be organizations that are serving people with disabilities. There's a whole bunch of different potential options where people might feel more comfortable reaching out for gender-based violence services that again aren't necessarily shelter or sexual assault centers. So I think that there's an opportunity for us to really look for hear more from people who might be accessing services in those organizations, as well as the people who are working in those organizations and doing that work. In terms of partnering with us, we're always eager to hear about people who are interested in doing this type of research and work. Again, the research spotlight that we're holding on December 8th is going to be an opportunity for people who have done some research to share their research, but also for people who just want to hear about the different types of research that's happening across the country to listen in and maybe connect with someone who is doing some work in an area that's a particular interest to you.
Okay, I have, well, it's not so much a question, it's more of a comment, but I was just fascinated with, you know, your findings in different areas, you know, in terms of, you know, perpetrators or people who use violence using COVID or COVID presenting as kind of unique control tactics to continue abusing their partner. I thought that was really interesting. And then you talked about how survivors, you know, COVID-19 almost somewhat mimics or mirrors the abuse in terms of, you know, the isolation. But I also found your comment about service providers, especially those who are working from home. And you know, you had a quote from someone who was working with sexual assault survivors. And the comment was, I had to invite those stories into my home. My entire living room or entire living space had been slimed with stories of sexual violence, making it hard to leave work, you know, especially with children, you know, having children in your home too, right? I just thought that was really, really interesting. And it's not something that I automatically thought of, right? And I don't know if you wanted to say a little bit more about that. I mean, were you surprised with that finding? I mean, when you think about it, you know, it does make sense, but I just find that a really fascinating comment.
So we did a bunch of media right when this came out, and folks really focused on domestic violence and sort of the impact of having to show up as workers to shelters every day. It was another front line, but they weren't seen in the same way that healthcare providers were. And there was a real bias to sort of getting that challenge, and really trying to pivot and show the challenge of folks having to work from home. And it was hard for folks to get that because a lot of us are working from home. And so it was kind of like, okay, cry me a river, I am too. And yet it is different. It's different when you're inviting trauma. It is different when you can't have those healthy boundaries and separation. And frankly, it's so connected in that the vast majority of the workforce in the gender-based violence sector are female identified. And so there is also the burden of childcare and the link around that, and home care writ large. And so that, I mean, that's something I'm experiencing in my life. You heard my toddler during this. And so it really became very real when I was reading other people's quotes, for sure.
Yeah, and you know, using the word slimed is just so apt, because I can just, you know, that just fits it well, so well. I'm just looking at the time. We've got another question. Did the research identify the impact of prevention programs for men who are the perpetrators?
No, I can't say that we had any specific data that really spoke to that. As I said, we did certainly hear about people being concerned about having to cancel prevention type programs, and that that this was something that you know, was important to keep in mind, because a lot of the conversation had been focused more on that kind of direct service piece that people were struggling with, but that losing the prevention and education that so many gender-based violence organizations do, especially, and those working with men and boys, is something that's been really difficult to do during the pandemic as well. So we didn't have any specific findings on that at this point.
Okay, and no other questions are coming in. You know, aside from you've received a number of comments saying, you know, well done, this is fascinating and interesting research, and thanking you both and your organizations for taking on this important work. Someone asked about a published report, but I think you had at the end of your PowerPoint that it's on your websites. Others were interested in your PowerPoint. I don't know if that's something that we can share through Resolve, or if that's something that you can make available through your own emails. But I mean, we're certainly happy to facilitate. So whatever works best for you.
We will share that through Resolve, no problem.
Okay. Great. Well, I'm just looking at the time. I think, again, thank you both, Erin and AnnaLise, for this fascinating presentation. You know, kudos for you for being so organized during a pandemic and getting this work out so quickly, right? It was just so obviously you were able to be responsive, and thank you to the organizations that actually completed your survey. You know, they were probably pretty busy. And so, you know, being involved in a research project like a survey was probably not on their list of priorities, but they obviously knew how timely this was and how impactful it would be. So I'm looking forward to doing our research here in Manitoba, but I certainly you know, really appreciate the work that you did, especially such during a very difficult time. So thanks to you both and your organizations. So I'm just going to now, so we've finished that presentation. I think we should have a break now. Many of you have been in lots of Zoom meetings and probably have, you know, Zoom fatigue. So let's take a 20-minute break, and we'll come back at 2:45 and we'll have our second presentation. Thank you. Hi, everyone. I think we are coming back and getting started. I'm going to get Nadia La Rosa from Clinic, who's also on the organizing committee, to introduce the next presentation. Nadia?
Thank you, Kendra. So our next presentation is on the sexual exploitation and sex trafficking of Indigenous women and girls. And our three presenters are going to share with us survivor knowledge on these issues, along with matriarchal responses and solutions informed by lived experience. And so it's my honor to introduce Elder Mae Louise Campbell, who is the co-founder of Clan Mothers Healing Village and Knowledge Center, which is a holistic land-based healing village with a focus on restorative and cultural therapies and programs, providing support to women who've been victimized by multi-generational trauma, sexual violence, sexual exploitation, and human trafficking. So the scale and scope of Elder Mae Louise's vision and thus experience is very broad. So keeping her quite busy. So I'd invite you to check out her bio that's on the screen. But amongst her many roles, she is the elder in residence at Red River College, as well as the University of Manitoba's Faculty of Social Work, Selkirk campus. She also sits on Mayor Bowman's Indigenous Advisory Circle. She's developed and operated the Grandmother Moon Lodge for the last 18 years, which is a healing lodge in rural Manitoba. And she is the wisdom keeper on the Grandmother Council of Manitoba. So Elder Mae Louise. It's also my pleasure to introduce Laurie Mackenzie, spirit named Great White Owl Woman. And Laurie is a survivor with lived experience who speaks publicly to bring forward the voices of those who have gone before us, as well as those that have been left behind. She is currently on the Knowledge Keepers Advisory Council, which is Tracia's trust and the part of Manitoba's strategy to combat sexual exploitation and human trafficking. She's also on the steering committee for Clan Mothers Healing Village project. And she is a regular presenter at the Prostitution Offenders Program, which is through the Salvation Army and the Manitoba Justice Department. So welcome, Laurie. And I'm also really pleased to introduce one of my colleagues, Kim Trossel. Kim is a woman with lived experience in the sex trade and a survivor of human trafficking. She is known for speaking her truth, and I can certainly attest to that, especially when it comes to activism for the rights and services and supports for sexually exploited and adult survivors. She's been employed at Clinic Community Health for the past 16 years as a peer counselor with the Dreamcatcher program, where she co-facilitates a support group for helping women and transgender women transition from the sex trade. She also facilitates the SWAT group and the Heart, Mind, Body, Spirit group at Sage House, which is a street women's health outreach and resource drop-in. So thank you to the three of you for giving us your time and sharing some wisdom. We really appreciate you being here with us. Miigwech.
Oh, really? I'm sorry. I don't understand all this fancy technology. Well, here I am. Thank you for the introductions. And I was excited about sitting with you today and sharing the little bit of knowledge I have over the years I have worked with our women. And my name in the spirit of our ancestors is Ishkitekiteikwe. The name translates into Fireheart Woman, and my clan is the Turtle Clan. So the introduction, thank you very much. Just to add to that, I'm now elder in residence at Mount Carmel Clinic, which is fairly new. But I'm just recovering from knee surgery now. And of course, COVID sent me home too. So I don't know at this time, am I able to just share something, or is it what's happening, Kim?
Sure. Sure, if you want to share now, that's great.
But was there a video you were going to show, my girl?
Yes, I can introduce the video first if you'd like, and then you can share after the video.
That's good. I like that.
Okay, great.
Thank
So I'd like to introduce Stop the Violence video, created as a response to lateral violence in our community. It was released December 17th, which is International Day to End Violence Against Sex Workers, and it's produced by our Jamie Goulet. Thank you.
There we go. Okay, hello.
And it's thank you for that beautiful. Every time I see that video, it gets me all very, very emotional. I still get emotional over it. It's been a few years now. So, so what can I say? Here we are today, and it's still happening. You know, it's still happening, and we have to really ask our question to ourselves: why does this continue to happen? With all the help, mind you, there could be more help for our women as far as help is concerned, but it's the kind of help. You know, we get confused about how do women heal? What do we need to heal? Are the programs that are presented to our women now, it doesn't matter what color your skin is or what you believe in or anything like that. It has nothing to do with that. It has to do with we as women. All over the world, women are still being abused. All over the world, there's still horrible things happening to women. And we see it here and we see it continue to happen. And now we have COVID. You know, now we have COVID. And so that's again is something else that is bringing teachings. I want to believe them as teachings from Creator, teachings from the universe, teachings to all of humanity as to what are we doing? What are we doing to each other? How do we think about each other? You know, the racism and all the other stuff that's going on. We have to stop that. And how do we do that? This is what I believe. I believe it's the power of women that will bring all of this craziness to a stop. And that's why you hear me speak that way, to empower women. So what does that mean to us? So we have all these places around that have been westernized, because of course our way of being and doing and seeing ourselves and our part in the world is a little different from the Western models. And by that, I mean, if all of us grew up with the kind of teachings even I should have received as a child by the grandmothers in our communities, I would have no problem knowing who I am. I would have no problem having to guess as to what I should be doing and what is my role in my community. I would have no problem thinking the gifts that I've been given by Creator the day I was born is to be of service to my people. And the gift that I was given the day I was born is to be a teacher, a mentor, a keeper of what we call the sacred law of the universe. That was my role, and that's what I would have been taught. But now we're in a place where the male energy is much more stronger than women all over the world, and women still talk about that. We still talk about it. When I see how we create different programs to help women, it's always about abuse. It's always about, poor you, you have to live like this. Poor you, why don't you stop the abuse? Poor you. You know, it's this pathetic feeling that we have to put on women because of they have given their power away to men. How many women do we know are still so afraid to speak up and to stand tall and live in their power, the strength and the sacred divine wisdom and knowledge and power that Creator gave us? When are we going to begin to do that instead of putting more of the emotional damage of fear in our bodies and in our thoughts and in our mind? That everything I must do as a woman is to please men. Everything I must do and the decisions I make I have to have permission. And the minute you don't do exactly what they expect from you, you're going against the spirit of who you really are. And our men, those who are mothers to young men, what are we teaching them? What we see today and what we watch in the universe is horrible. all the movies, all the games and everything else that's on that screen that we're watching is all about the power of men. And it's always women being have to bow down to them. When are we going to stop doing that? So I've been thinking about this for a long time, and I've been working with women for so many years. You know, when we started Grandmother Moon Lodge many years ago, that's what it was about, is to empower women. So how do we do that? Through ceremony. We don't focus on all the pain and the trauma and everything that we've had in our past. Not to say we don't have to do that, but we have to do it with a different way of thinking about it. It's not about keeping yourself down, feeling guilty, feeling shame, and all those kinds of things. It's about saying no more, because that's not who I am. That is not who I am, and that's not who Creator expects me to be. I am the strong, powerful woman who can overcome anything, who can overcome anything. All the pain, all the trauma, all the things that have been done to me are not me, and they don't belong to me. I will rise above all of it. And that's what we're trying to do when we work with women now. We're trying to create programs that will build up their spirits, not keep them down. We have to create programs that will celebrate who we are, and to understand that all women are extensions of the Earth Mother. And our job is to take over everything that we must to bring peace and harmony and unity and equality back to the people of the earth. That's who we are. And we have to teach our women that. When we gather now, we're looking at doing another village project. Everything we do at the village will be to empower women, not to sit in circles and talk about your trauma and your pain forever and ever. No, to move above that. Let's talk about it. Do what you have to do our ceremonies, do all those kinds of things to help you get there, but to give them opportunities to prove who they really are. So all of that will be done on our village, and we're creating social enterprise so they don't just sit around and smoke cigarettes and talk about their pain, okay? Let's move beyond that. Let's go outside and create a garden. Let's go run, let's go exercise. Let's do something with our hands to show and to bring our gifts to light. Let's support each other with love and sisterhood and patience. Let's not put each other down anymore. Let's love each other and learn to love yourself. That's what we have to do by changing programs. And that's what we intend to do and will do at our new project called Clan Mothers Healing and Educational Village. And I've learned that over the years because I've been doing this for so many years. 45, first I had to heal myself because I know what it's like to be pain and to live in trauma, to live through alcoholism, to not have food to feed I've been there, done that. I've seen my nieces and nephews die from drugs and alcohol. I had alcoholism in my family, and I'm the youngest in my family. And somewhere along the line, I knew I couldn't let that happen to me. I just knew it. I had 5 children to look after and to feed while their dad was out drinking up all the money that he had earned. I'd been there. And I said, no, there has to be a different way. And that way is to develop my own thoughts, my own mind, to love the woman in the mirror, to say every day, and I did that for 2 solid years before I began to believe it. I love you. You are a strong, powerful woman. You will not give your power away anymore. You'll turn it around and empower yourself. Don't blame anybody else anymore, because you are true and you are real and you are a strong, powerful woman. So begin to act like it. Begin to act like it. And I had to do that for 2 years before I began to believe it and then begin to act like it. So I know that it is possible. And that's what we're going to do when we start doing our programs with the women that that so many of them that I've worked with over the years, many times I meet them and they'd say, Mae Louise, we learned so much through your teachings. And that's Indigenous. That's Indigenous way of being, doing, and believing. So thank you very much. Miigwech.
Thank you, grandmother. Thank you. I just want to introduce a quick teaser, a matriarchal Indigenous-led response and solution to sexual exploitation and sex trafficking, informed by national lived experience leadership. I encourage everyone to check out the full video project, experientialvoices.ca, and the Clan Mothers Healing Village project at clanmothers.ca.
Thank you. Welcome, everyone. Thank you very much for attending this webinar. I'm going to give a speech here. In 1982, the United Nations launched a working group seeking to examine discrimination against Indigenous populations globally. The working group set about research that would consume the next 12 years. In 1994, the working group presented a draft to United Nations. It was another 12 years before the United Nations Declarations of Rights of Indigenous Peoples, now I will refer to as UNDRIP, was signed by 144 countries. 4 countries voted against the UNDRIP. Those countries are the USA, New Zealand, Australia, and Canada. All those that voted against the UNDRIP were deeply seated imperial colonial structured nations still embroiled in the denial of wrongdoing and discrimination. These 4 nations finally added their names in a session in 2009. It would be another 3 years before Canada found a way to face their historic demons. Canada has long denied any discrimination or exploitation of Indigenous people, but in 2012, it saw the beginning of change. The Truth and Reconciliation Commission, now referred to as TRC, launched a nationwide fact-finding mission and recorded the stories of thousands of victimized Indigenous people. This marked the beginning of change, but change at a government pace takes generations. We, as Indigenous people, cannot afford to lose another moment. The TRC efforts launched yet another huge step forward, the National Inquiry into the Missing and Murdered Indigenous Women and Girls, now referred to as MMIWG. The MMIWG launched its national inquiry in 2016 after national statistics revealed a substantially higher rate of victimization among Indigenous women. The subsequent report details 231 calls for action, while also declaring that Indigenous women have the right to 4 things. 1, culture. 2, health. 3, security. And 4, justice. Substantial gaps in services and systematic discrimination and violence led many to the world of exploitation and trafficking. This is the first step down the road of the MMIWG. The colonial institution find it justifiable to dismiss the trafficked, blaming the victims for their own violent circumstance. Law enforcement executes a limited inquiry, asserting that the victim chose their circumstances. Healthcare facilities claim they have neither the resources nor the expertise to assist. We cannot expect the colonizers that shattered the respect for women to now assist in the healing of this women. For these reasons, the Clan Mother Healing Village was established and seeks to connect and heal the wounded amongst us through self-sustaining systems, thereby requiring limited government supports while providing substantial personal sweat equity, compassion, and social enterprise to perpetuate the system. It is a system of multiple bottom lines. Clan Mother Healing Village reestablishes the connection to the land and the Indigenous ways of knowing, creates and provides essential healing functions to the community and to the Indigenous victims, while also creating value through social enterprise through the training of the victims, the education of subscribers, and the decreased load on government system and services. This multiplier effect is also called the social return on investment, which I will refer to now as the SROI. Return on investment focus only on the revenue generated, whereas the SROI also calculates expenditures that will be unnecessary due to the venture. For example, a trafficked victim, once they have completed their healing journey and found valuable work, first decreases the demand for funding on correctional and health facilities, while simultaneously contributing to the tax base. Similarly, this impact can be multiplied as the cycle of sexual exploitation and violence is interrupted and corrected, not only for that individual, but likely for anyone they have regular contact with, including subsequent generations. A stone thrown into calm waters emanates ripples from its center that impact the entire body of water. Similarly, with the addition of the stone, the water and land are all elevated, changing the landscape forever. Clan Mother Healing Village Social Enterprises is a stone, interrupting systems of violence and introducing Indigenous ways of knowing, healing, and adding value. All of these inquiries and global level adjustments were necessary to move nations towards healing. However, it remains for Indigenous people to create the systems to heal themselves. A colonized system cannot heal what it broke. Only the restoration of what was destroyed can heal, returning to the matriarchal ways. This shift in global conscience has produced the right circumstance for an interruption to violent prejudice systems and the creation of Indigenous healing systems. We are the generation our ancestors prayed for. Miigwech.
Thanks, Laurie. Good afternoon. We've been discussing responding to gender-based violence as it relates to sexual exploitation and human trafficking of Indigenous women and girls today. We will not be discussing decriminalization or consensual adult sex work. Languages are very diverse across Canada. And when we're discussing the sex industry, even here in Manitoba, it's a debatable conversation and seems to be divided into a couple of sectors. Survival sex trade, where individuals are being exploited and trafficked, those that identify as sex workers, and then those individuals who have free choice. The sex work debate refers to the polarized views in prostitution. It really bothers me when agencies and engaged survivors try to dictate our narratives, trying to lump us all into one category and decide for us what's going to be said or done. And when we're the experts of what we need, and we should not only own our stories, but decide who and how we share our stories. Although there might be similarities in our stories, we each have our own unique experiences. Now, according to Tracia's Trust report that was released in 2019, the collaboration and best practices to end human trafficking and sexual exploitation, and a lot of it was discussed in the videos already, but why people are exploited, are systems. We need more education and understanding of exploitation. The normalization in society, the need of more belonging and attachment, the need for healthy family connection, substance abuse or addiction, predators, post-trauma or abuse, including colonization, racism, discrimination, vulnerable or marginalized groups. And I just want to make note of our transgender sisters especially. Technology, media, social media, the needs for more basic needs, just survival, needs for more services, gender discrimination and violence, intergenerational exploitations, disabilities, low self-esteem and peer pressure, poverty, economic gain, and mental health challenges. And just a separate side note, especially during COVID, we still do not have a 24/7 safe space for adult services. All the cuts to existing services, especially during COVID, our survival sex workers can't apply for benefits like CERB. And human trafficking has also increased during COVID because of the isolation piece. What I'd like to discuss is the long-term impacts on the women based on my personal lived experience in the sex trade as a survivor of human trafficking, as well as the work I've been doing for the last 17 years supporting women transitioning out of the sex trade. As a survivor of sexual exploitation and human trafficking, I exited over 25 years ago. I am still impacted by the multiple layers of trauma experienced while working. And I'm still on my healing journey and still suffering from long-term complex PTSD, anxiety, and flashbacks. Disassociation is common amongst us survivors. It wasn't about 8 years ago, I was present for the first time with my partner in the bedroom and didn't disassociate. Up until then, I would either disassociate from my body or I would feel the need to play a role and satisfy my partner. And when I wasn't satisfied, I would feel like I was ripped off for not getting paid for a sexual act. So anyway, according to Melissa Farley's research done in 1995 and quoted in Prairies, Victoria, rates of PTSD amongst 130 prostitutes from San Francisco and 110 from Thailand were higher scores than 123 Vietnam vets and 1,006 Gulf War vets. Now, the federal the Federal Advisory Committee on Gender-Based Violence website states that 60% of Canadians know a woman who's experienced physical or sexual abuse. Indigenous women are killed at 6 times the rate as non-Indigenous women. Prairies, Victoria states chances of a sex worker getting beaten up, raped, murdered, or mutilated are 120 times more likely than any other demographic, and the least likely to report it. And unless they report it to something like the bad date list to inform others. Street level sex trade only represents 5 to 10% of the sex industry. The rest is found in independent escorts, escort agencies, massage parlors, adult film industry, bathhouses, brothels, the list goes on. In Manitoba, street level sexual exploitation, prominently 80% Indigenous, which also has devastating statistics associated to the murdered and missing women and girls. In a paper written by Catherine Koster, 17 Facts About Violence and Sex Work, she says lots of variations exist in sex work vulnerability to violence. According to the systematic review of research on violence against sex workers, criminalization and policing, population movements and mobility conditions, gender inequality are all correlated with the increased violence against sex workers. In other studies, youth, homelessness, individuals that have been previously arrested for prostitution, migrant sex workers who use drugs, and street-based sex workers are especially at risk of violence. After years of disconnection, long-term mental health issues are prevalent. Social connection is an important part of our healing, building community of healthy peers. This work can literally be consuming, taking over your life, especially as a person with lived experience. It's difficult to unsee, unhear, or disconnect and turn off your radar. This is the community I come from, that I'm connected to, and it often triggers my PTSD and have experienced vicarious trauma. The average social worker working with survivor community lasts about 4 years before burning out. Our program has gone through 5 social workers in 17 years. It's not easy work, but I find it extremely rewarding. During COVID, our work has drastically changed, shut down so many of our programs and services to outreach. And for many of us, trauma isn't healed through the Western practices or textbook knowledge. It's done in love, in ceremony, and land-based teachings, in the matriarchal Indigenous ways. I can't wait for the day that the Clan Mothers Healing Village and Knowledge Center opens its doors. Remember to check out both of the websites. And just a shout out to all of our frontline services, our doctors and nurses especially. Tonight, 7 p.m., Pots for Docs. Knock and make all the noise you can, 7 p.m. for our doctors and nurses and front lines. Thanks very much.
Wow, thank you to all of you. What a wonderful, powerful presentation. The videos were powerful, but your voices, your stories, what you talked about, your own lived experience in this area or helping people it was just very powerful and thoughtful. And I want to thank all of you very much for contributing to our webinar. I certainly learned a lot, and I'm hoping that the Clan Mothers Village opens soon. I'm looking at the chat, and that's the question everybody's asking is, when do they open their doors?
Not soon enough in my eyes.
Yeah, it sounds like an amazing initiative, and one that's so terribly needed. I've done work, with women who have been sexually exploited through human trafficking. And Kim, as you talked about the level of violence, the article we wrote was called The Everyday Occurrence, and it was every single day. It was relentless. But the resilience that women show in spite is just incredible. So thank you to all of you. I'm just wondering about, I guess another question that people had was about how we can make these videos available and your presentation available. I'm mindful that people shared really personal stories in that video. So perhaps maybe we can talk next week about how we can make this video available. I certainly don't want to share it on our website if those in the video did not consent. I'm not sure how kind of private that video is the first video that you shared. So we'll connect more about that, but it was a very, very powerful presentation. And from everybody that's on the chat, they thank you as well. So I don't know if you want to say a few, like, again, most of the questions are really about when does this initiative open? Are you able to kind of share anything about that, or an update or next steps, or?
Laurie, our grandmother, one of you?
You know what, I can share a little bit.
I'm just bringing Jamie in.
Yeah.
Great.
Yeah.
We're really, the land acquisition, when we did get the land given back to us from the Catholic corporation, actually.
Okay.
Yeah, so that has happened, and we're in very good standing right now, but we've got a lot of work to do, and we have incredible allies and our community supporting this. And the idea is, I'm going to have to say, not for 2 more years, because we have some incredible fundraising campaign that will be hitting. You'll hear about it. And we're in very good standing, but we've got a lot of work to do, because a vision like this doesn't happen overnight. This is it's a holistic healing center. It's very well informed, it's very in good standing, but we've got a lot of all the operational, we've got a lot to do yet. And so the idea is that we created something that was also changed right from the core, right to the governance system, and that's another very interesting concept of holistic healing. Yeah, so that's what I could say. I would say 2 more years we have.
Wonderful. Thanks, Jamie. Well, we look forward to hearing more and wish you nothing but the best on getting this off the ground. I'm just mindful of our time. Again, thank you to you all for presenting. We would like to do something in the future, another webinar. I know many of you commented on how this has been a very good learning experience, and that's part of Resolve's mandate. And I guess I was a little remiss. I didn't really speak about what Resolve does. Resolve is a Tri-Prairie Research Center on gender-based violence and violence against women and girls. And we have offices at the University of Manitoba, University of Saskatchewan, and University of Calgary. We were created after the 1989 Montreal Massacre, and we're part of an alliance of 5 research centers that look at violence against women and gender-based violence. So we basically do research, community-based research. All of our research is community-based, as well as education too. So please stay tuned. We would like to do another webinar as well. You have in front of you how you can stay connected with us. We have lots of various social media that you can stay connected with us. So please join us. We also have a Resolve newsletter, which we're going to be putting out in the next week or so, our fall winter edition. So, and we also have a website that you have to be patient with. We are redeveloping it, but it is active, just doesn't look that pretty right now. Anyway, so please stay connected with us. Next slide, Patricia. And again, just a reminder, if this webinar was difficult in any way and you need to speak with someone, you know, in addition to resources within the community, there is the Shelter Safe program, and they have resources for all over Canada. And again, many of you are in the Prairies and perhaps beyond. So please reach out to this organization or others if you're needing. Next, Patricia. And again, I just really want to thank everyone. Thank you to Circling Buffalo, our co-partner on this, as well as those on the organizing committee, and Patricia for your work on all this. You and the University of Manitoba really made this happen, so thank you. It was our first webinar, and I think we did a great job. And I also want to thank our presenters, fascinating work that you did. And I thank you for doing this work, this very important work, and for sharing it with us. So miigwech. And finally, I just want to thank everybody for attending our webinar. We had, I think, 225 or more registrants. So thank you so much. And again, please reach out to our centers. We do want to stay connected. So thank you for all of you. And it's almost 4 o'clock. And I just want to say, for all of you, be well, stay safe, and of course, stay sane. So that is the end of our webinar, and we will be in touch about how you can get recordings. Thank you so much, everyone.